I've been a pediatrician for 25 years, and I want to go through 4 instances for y'all very briefly. When I was in Texas, and my southern drawl will give you away because that's where I'm from before I moved here in 2003. In East Texas, Medicaid payments got so low that the entire portion of East Texas, from Texarkana down to Houston, Texas, you could not find one doctor who would take Medicaid. Not one. They couldn't afford it. How can you have a visit for $6? Catapulted me to Georgia, and we inaugurated Peach Care, and that was to provide universal health care for children. And the first year it worked fine because there was plenty of money. And then the costs were underestimated. Now 1/3 of the pediatricians no longer take Peach Care, and the majority of pediatric specialists don't take it. So they're insured, but they can't find a doctor. My colleagues in Tennessee had TennCare put on them, and 1/3 of the pediatricians were driven out of practice within 5 years. Those were the rural doctors. Then we'd go to Louisiana before we came here, and my colleagues are bemoaning the fact of how low the Medicaid payment rates are. They cannot survive. So we moved to Nebraska, and I come to find that 11 counties don't have doctors, and that's wrong. Well, let me tell you something. 887. If you think 11's a problem, in 10 years, try 30. And the only places that are going to have qualified doctors are communities over 15,000 with a hospital. But then you're not going to have the subspecialty care. I train nurse practitioners, and I'm going to liken it to this. I graduated medical school in 1982. In my wildest dreams, with the biggest ego you could imagine, did I ever think that I could go off from medical school and go practice. We're going to ask people with 4 years less training to go out and practice medicine. I did 3 years of pediatric residency, which culminated in about 14,000 hours of training. Today, the average doctor spends 12,000 hours, and now they want to waive the 2,000-hour restriction. We will not hire anybody to work with us under that unless they go through the 2,000-hour mandate. That's why expansion and putting people that are ill-trained and ill-qualified out there is going to drive up medical costs. And it's the same thing with the optometrist bill. Optometrists are not ophthalmologists. Maybe a little easier to spell, but they don't provide the service that an ophthalmologist can. Ophthalmologists are very skilled at not only diagnosing disease, but also treating the full range. Optometrists, very limited. And now we're talking about expanding their ability to provide care. So what we're going to do is offer a charade with these latter 2 bills. We're going to say that we are going to supply you with a whole range of specialists who are capable of providing that care. And the answer is a flat no. And for those who live in rural counties, you're going to watch your hospitals disappear, and you're going to watch your very precious medical resources disappear. And what you're going to end up with is the equivalent of a Walmart or a Walgreens clinic providing health care services to your populations. I cannot stress to you that what I see out there is very frightening. And many of my colleagues out there who do not support this understand what's going to happen to their ability to provide medical care. Those who do support it have no idea, because we had the same proponents in the 4 states that we had. And guess what? Most of those people are not accepting Medicaid. Some of them are out of business.
Well, let me interject one thing on that as well. The other states that have gone that route have gone the expansion route, are seeing a very disturbing trend of brain drain. A lot of the people, or a lot of the doctors, don't just refuse to take Medicaid patients anymore. The older ones just say, I'm going to retire now. I'm out of here. I don't need this. I can't take this. They're gone. Our most experienced are leaving. That's not that doesn't bode well for long-term trends. That is not wellness, but it's a reality, and it's something that when you place restrictions and onerous burdens, you're going to get it. When people have alternatives, they'll take them. So
the last thing is people will say, what is the alternative? There are two alternatives. Mayo Clinic has a model, so does Intermountain Healthcare. And a number of years ago, there was analysis that was done on Mayo Clinic and said if we use the Mayo Clinic model, we could save 1/3 of the healthcare costs in the United States. If you use the Intermountain Healthcare model, you'd save 1/2, and you'd have a better care. It's all published. They teach people how to use that model. We actually have 3 people now in training at Children's Hospital. The cost to train one individual to go into a hospital and lead that charge is the equivalent of what you would pay to treat one complicated pneumonia per year. And that would be one individual trained who would be there for the entire time. There are other models other than this. The Intermountain Healthcare model saves $250 million a year and saves an extra 1,000 lives per year, more than what actuaries say they should be able to do. And they do that because they're always studying quality and how to improve healthcare. And many of the studies that they have inaugurated and done and published, we are adopting. We're smart enough here in the state. One of the reasons Mary Jane and I moved here was the number of smart people here. Yet we keep adopting dumb things coming out of Washington.
That's right.
I hate to say it, I feel the epicenter of intelligence starts here in Nebraska, and the further you get away, it drops off. In my mind, what we need to do is look to our own citizens and our own smart people, and we can come up with a plan picking the best private initiatives, some public, but do it in such a way that it isn't centered out of the government for all of our healthcare issues.
And that's precisely why those models receive resistance. And it's because those models do not vest the control and power into a government system as the ACA requires.
Just to leave you all one other thing, President Obama in 2009 said that Intermountain Healthcare was the model that the United States should use for its healthcare system. They invited the executive director, Brent James, to come and speak. He's an oncologic surgeon. He came there 4 times to testify. And the Obamacare bill contains nothing of the Intermountain Healthcare model. It is just absolutely asinine. And yet we are expected to say that Washington can dictate our health care. Absolutely not. Not unless you train at George Washington University, National Children's Hospital, or Georgetown. I'll listen to those 3 organizations. But anything else coming from the White House or any of those, I say no. And the folks who designed this bill, I see the hands of people who believe in the big government model of health care. This will not do it. And everyone in this state is going to suffer because of it.